Welcome everyone to ICAN. Today's show will be about Jefferson County Drug-free Coalition. The Jefferson County Drug-free Coalition, established in 2017, is a group of people and organizations working together to prevent and reduce the abuse of alcohol, tobacco, and other drugs among youth and the greater community. Their members include parents, youth, school staff, law enforcement, pastors, healthcare, and government workers. They invite anyone from the community who is interested in substance abuse prevention, treatment, and recovery. Today I will be interviewing Benjamin Van Buren of the Jefferson County Drug-free Coalition. Welcome, Ben.
Open our hearts, free every soul. The fear inside, you must let it go. Oh, that monster, before it conquers you. Yeah, we all have demons, we fight every day. You get knocked down, but the bell hasn't rang, so keep going. Just stay focused when life seems hopeless. Before life passes you by, you must, like a bird with broken wings always. You've got to reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. Never stop dreaming, even awake. Nothing can stop you from winning this race, so keep going. Just stay focused. Yeah, I am the tiger, I own the prize. Every storm is with the rainbow in the sky. You are golden. If no one else noticed, don't stop, keep going. Before life passes you by, you must, like a bird with broken wings always. You gotta reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. You gotta try. All you got to do is try. Oh, you gotta 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 try. You gotta try. All you got to do is try. You gotta try.
I think the biggest piece of advice I have for someone going through addiction or thinking about going to rehab is being honest with yourself. Don't be afraid to get help. I think that's the biggest stigma that we're trying to erase is don't be afraid to ask for help.
Hi, welcome back. I'd like to introduce Ben, how do you say your last name?
Van
again?
Haren.
Van Aaron from the Jefferson County Drug-free Coalition. Ben, can you tell us a little bit about the coalition first?
Yeah, well, it's exciting to be here. We are the Drug-Free Coalition. So we are We're an organization that is, it was kind of created as, there's something called the Drug-Free Communities grant. And this was established by like the government, the federal government, back in the 90s. And it really is kind of like the flagship program for the federal government to, do what it can do to prevent and reduce substance use in really across, America, in all populations. And so, yeah, the short version of how that works for the Drug-Free Communities grant is places like us. So I work for the Jefferson County Health Department. And so what happens is it can happen in several different ways. Groups might come together, different agencies might come together, and they might really want to address this issue in their community, and so they can apply for this grant. And yeah, so we have two kind of main tenets with shorthand is DFC, which I'll probably say quite frequently. So our two main tenets are, one is to build coalition. I know coalition is kind of a weird word, but it really just means bringing people together and working together. So we have, there's so many in all communities. You're going to have a lot of different organizations, hospitals, schools, different substance abuse agencies who are all passionate about this and want to do this work. The advantage, the reason we kind of come at it from this kind of larger scale is we want to bring those people together, because like a hospital can do a lot of great work to advance a lot of different programs or do things a certain way to try to help.
Right.
But there's a little bit where they can only do so much because they just kind of have this one specific area that they're in. So the one advantage, in theory, that where we come in is we can hopefully bring people together, law enforcement together, schools, healthcare, bring everybody to the table, as they say, and work together to try to address things across the community, but also kind of across, fields and areas.
Okay. Going back to you a little bit, what got you into this field and why do you do what you do? Is there some personal reason?
Yeah, so I was working at, for Jefferson County for several years. And this, originally what happened was there was a position open for, so I'm like the lead coordinator for the coalition. At the time, there was kind of this assistant position where we were working specifically with youth in schools. And so there was that position over it. So I applied for that. I have some experience. When I was in high school, I did a little bit of tutoring. Like one of my classes was kind of helping out a math class. I have experience, it's not directly related to this, but kind of working as a camp counselor as a kid. So I have different, I had a little bit of experience working in that field. And so I worked as that for some time. And then, as you know, Emmy, who used to be in the position I am in now, she did leave, and I kind of stepped into her role. Okay. But yeah, I do also, there is some kind of personal experience as well.
Okay.
Just with, family and friends, seeing them go through it, having that exposure to the system. And having a little bit of background information about it, and hopefully trying to be able to change, some things.
Can you tell me about some of the ways the coalition has impacted the community?
I've got a lot of ways. So yeah, what might be a good way to kind of frame the description of this is DFC. What we're trying to do when we're looking at, so our main goals is to organize the community, bring them together. Right. And then we want to prevent use.
Drug misuse, yeah.
Yeah. I think that's something that is, in the media, a lot of people will see opioid overdose deaths, or, just, we've had this for forever, and especially in Wisconsin, the side effects of, excessive alcohol use, and what that brings, as well as tobacco and the problems and the diseases that cause. So those are obviously, I think most people are kind of aware of those kind of issues. So I think one good way to think about it is we use the word prevention a lot, which is another one of those words that just they use a lot, but we think about this problem of people using substances kind of like, if you have people like are falling down a hill, if that's representative of use. A lot of what, hospitals and law enforcement or even schools, they are seeing after the person's already fallen down the hill. And we do want to help them. We want to put resources into, this kind of harm reduction idea of, helping people after they fall down. We want to care for them. We want to, help them rehabilitate and kind of take care of them. But our real goal, kind of the partner goal, we want to stop them from falling down the hill.
Right. Help them before.
Exactly. So the prevention is really about what can we do. Like we don't want to we of course want to bring the ambulance after when they've fallen down, but how can we build guardrails before this even happens? There's a lot of different ways you could do that.
And what different, can you go into depth in the different ways that the coalition does?
Yeah, so.
Maybe start with like the cigarettes and vaping and alcohol and so on and so on.
Yeah. So with cigarettes and vaping, that's definitely one of the topics, we talk with area schools, and we try to work with school counselors there. That's definitely obviously a big, issue that they come and say, here's what we want help to work on. And so a lot of the prevention things that we do, building that guardrail, is around working with schools and preventing that. So a few examples are, one of the big ones is we have, because obviously there's a lot of different parts of it. There's easy access to these nicotine products.
Yeah.
I mean, you can hide them anywhere.
Yeah.
That's one of the things we do, actually. We go to schools and we have this whole display of like, here's what looks like a normal maybe bedroom setup, and but there's actually 30 vape devices hidden in there.
Yeah.
How many can you find?
Yeah.
So there's a little bit of education we try to do. But if we think about the guardrails, how can we actually prevent this? A big thing is obviously talking to parents, getting information to them. So maybe we want to work with the schools to say, hey, maybe we can develop a document or a brochure or something that's really easy to read and hand that out to have the schools distribute it to the parents at the beginning of the year. And they can say, here's some quick fun facts about these different substances, and here's some more information. One of the big things with parents is it's a campaign that the Wisconsin Department of Health Services have, but it's called Small Talks. And the idea is how important it really is and how much of an impact. I think a lot of parents obviously know the impact they have, having these discussions, but it's really highlighting just how impactful it is to have those discussions at an early age about, just knowing, kind of what's going on with your kid and talking to them about it early on. That really makes a
Have you noticed any change since Juul has been taken out of the equation? Because Juul was really the top contender for the vaping.
Yeah, there's been a whole roller coaster with that, at least from like the federal level. So the federal government, they were trying to. There was some kind of things that were happening, and they were essentially trying to take Juul off the market because they weren't listening, they weren't complying with the federal government in some way. And I think they actually got it. I don't think Juul's off the market anymore. I could be mistaken about that, but I thought they had reverted on it.
I haven't heard it come back on.
Okay. Well, the problem is, while that would be impactful, there's so many other
Right. I understand, but Juul was the biggest company, it seemed like.
Yeah.
Anything else on the vaping that you'd like to?
Yeah. So one thing that, in the sense of like, what is a guardrail that we could do with vaping? We had one of our area schools was seeing a lot of vaping shops going up next to like the high school, which, it was a little. You can kind of see what what they're trying to their intended market, even though you're not technically supposed to.
Yeah, I know.
Sell to underage people, but yeah, so they actually passed an ordinance that said, we just don't like all these vape shops going up near us. And so they passed an ordinance that you can't open a new vaping-related shop within 1,000 feet of a school. So what's great about that is that's something that's kind of, once you kind of get on the books, that's established, and then that's kind of long-lasting. Another thing that we've been working on is schools have said, we kind of need help with how can we, when we get kids who are vaping, it's not so easy just to stop, because nicotine is a very addictive substance.
Very.
And so the schools kind of wanted assistance with how can we, when someone gets caught, they kind of have to go through a few steps as a student. So what could we do to really help them? So we located, so we've actually been training several schools on this curriculum that really focuses on, it's the right idea to try to say just stop using, but that's in reality very difficult.
Yeah. I know my husband smoked,
yeah.
and he just quit. So.
Right. It's not.
No,
an
and
easy
he
thing.
started when he was 12.
Right. Yeah. Well, so the idea is we want to focus on, I think there's been a move to focus more on mental health in general.
Yeah.
But this is a curriculum that really gets down to, it's not just saying, just stop doing it and it'll be better. It's okay, let's look at why you started to vape and what are the underlying causes, because it's an unhealthy coping mechanism.
Yep.
And so, these kids are in need of these kind of, coping mechanisms, and sometimes you can find one that's unhealthy. So I think the real goal of it is to drill down and say, how can we, encourage healthier coping mechanisms?
Yeah.
So that's pretty exciting.
And how is the alcohol problem in our communities? Is it bad? Is it good? Obviously it's not good, but.
Right. Well, that's a good question, because
Or do you see the drugs more than the alcohol now?
I think from maybe like a national perspective, we've obviously, there's been this huge rise in, as I'm sure everyone's heard by now, the fentanyl epidemic.
Yeah, fentanyl, yes.
So I think that really has taken center stage
Yep.
from a media perspective. But I do, there still is, we shouldn't overlook.
Right.
Alcohol is just so normalized.
It's a major part of our community, our part of everything in you do.
Right.
Every event has alcohol involved.
Yeah.
Almost, You
Yeah.
can't do anything without alcohol being involved, it seems
Right.
like.
Yeah. When I went to, UW-Madison when I was in college, and there are no strangers to like that being a part of school. Kind of everywhere in Wisconsin, especially in Wisconsin, it's just so entrenched. But yeah, I think I was looking up. There was 140,000 deaths from just alcohol in the United States, not just in Jefferson County, of course. But it is a big issue, and there's, of course, I think it's always important to say there's nothing wrong with enjoying
A
some
drink
alcohol.
here or there, but.
Right. Yeah, we're kind of talking about the excessive use, or
Yeah.
it can become very addictive as well.
That's why I like the events that you have going on through the Jefferson County Drug Coalition, the Sober Bowling, and there was another one that they just started. Is it? I don't remember what it was.
Yeah. Well, yeah, and I think you're talking about there was an event in Jefferson.
Yeah.
It's called Recovery by the River.
Yeah.
So one of what's going to happen in a place where alcohol is so normalized, unfortunately, is of course there's not necessarily anything wrong inherently with drinking, but when it becomes so ingrained like that, there can be peer pressure to do it when you might not want to. You can maybe over encourage people, or there are plenty of people who just don't necessarily, whether they're in recovery or they just would prefer not to drink. There is as you're saying, it can be really, really difficult to find it, do anything.
Yeah, it is. I come from a family of alcoholics, so
yeah,
it's hard.
It's everywhere.
Yeah,
all the
it's
time.
everywhere. And I do have a drink now and then, but it all brings it all back, so I don't very often.
Right. It's so easy.
Yeah, it is.
To maybe drink more than you planned or were expecting to. So one of a piece of our coalition there's a lot of kind of passion around is how can we provide more sense of community for people who are, maybe they're in recovery, maybe they just would prefer do things without substances or substance-free things. So yeah, we have the coalition's kind of been working with a group who's been doing this sober bowling is what it's called, and so
Yeah.
the first Saturday of every month
Yeah. Yeah. But
in Watertown.
yeah, we
have bowling.
interviewed the Emmy? No, what's her name?
Emily.
Emily.
Yep.
We interviewed Emily a few months ago about the sober bowling.
Yeah.
In fact, we donated $1,500
Yeah.
to the event.
Well, and that's been a huge help.
Yeah.
We've been trying to support it with different kind of funding. We got a grant for it actually to pay for a little bit, but it doesn't let you pay for like pizza or like
Yeah,
some
yeah.
fries. So that was really great actually because that's really helped kind of give some flexibility.
Well,
for
that's what the
them.
Elks are about. We like to help out with communities, agencies, and
Yeah.
I've been involved with the coalition now since it's going on 2 years now. So, and I really miss Emmy.
Yeah, she's great.
So, I guess on to the big topic is the drugs.
Yeah.
I have worked alongside the coalition at a few events, and I find that your organization is very insightful and goes out of its way to share drug and alcohol misuse in our communities. Can you tell me a little bit about what you do for this part?
Yeah. So when you make one of these, when you create our DFC, our coalition, when you create one, you're supposed to like focus and pick like a few topics. So we've essentially a few like different kinds of drugs. So the substances we obviously do alcohol. We focus on alcohol, nicotine/tobacco, and the other one is really kind of opioids, but there's a little crossover with prescription medication. So that's really kind of our main focus. It obviously kind of bleeds out into other things, but yeah, we do a lot of work. Once again, I think most people have kind of heard about the opioid epidemic, the fentanyl epidemic. But yeah, there's a lot of overlap. So we do a lot of. So I did bring some props. Maybe we get into it now, or maybe in a little bit. But there's a.
Well, you have a Narcan program, don't you?
We do.
Yeah.
Yeah.
Where you show people how to use it and make it available to whoever needs it, different
Right.
agencies. Like, I've been meaning to contact you, and I think we should have some at the Elks. So, but where do you like to see to have the Narcan?
Yeah.
Where, like churches or, well, hospitals, I'm sure, but where else?
Right. So yeah, our overall goal is to. So the idea of if anyone hasn't heard of naloxone or Narcan, it is just it can be so easy to overdose from opioids and fentanyl. Fentanyl is in everything.
Yes.
And all kind of if you've heard heroin, if you buy heroin on the street or something, it all has fentanyl in it.
Yeah, I've even heard marijuana is.
They find it in when people buy cocaine, unfortunately, or if people are buying pills that they think is something, but it's actually fentanyl kind of mixed in there. It's so dangerous. Fentanyl is, there's always been kind of an opioid issue, but as of 10, 12 years ago, fentanyl is ramped up, and fentanyl is 50 times stronger than morphine is.
Yeah, and we've had a lot of deaths.
Yeah.
Thousands of deaths because of it.
I think this is another one of the facts that I looked up. In the U.S., between April 2020 and 2021, there was 100,000 overdose deaths. So it really is a huge
It's
issue.
scary.
Yeah.
And now they're saying that they're putting it in to make it look like candy too.
Right. Well, and that's been another kind of news story that's kind of popped up as well, that people have probably heard about. So Narcan, or naloxone is just the generic name. It's like Tylenol and acetaminophen. Naloxone is all it does when you take too many opioids, when you have too much fentanyl, it slows your body down. It's a central nervous system depressant, is what it's called. And when you take too much, it slows your body down too much. That kind of the old part of your brain that helps you automatically breathe. Eventually, that starts shutting down too. And obviously, the big problem with that is then all of a sudden you stop breathing. It's hard to breathe, and that's where overdoses can quickly lead to death. So yeah, not breathing is obviously not a good thing. So all naloxone does is it reverses opioids in the brain.
Okay.
So it'll go in on the receptors, it'll kick the opioids off for a time, and it gives you a chance. So an easy way to think about it is to just kind of revive somebody if they've overdosed. So it is a really great tool, and it's really safe. I did bring a little, this is one of the props I brought. It's definitely something that has been getting more popular, which is a good thing. So they, originally, let's get this to all of our EMTs, all of our first responders, police and fire. But there's this stuff which works really well. If anybody can have naloxone or Narcan, and it's designed to be really easy to use. So one thing that we do is, so we're an access point. It is legal to have this and use it for anybody, as long as you're using it with good intentions.
Yeah, right.
And technically, you can go buy this. There's a standing order, so anybody can go to a pharmacy and say, I'd like to have some. It's kind of expensive if you were to just go and buy it. So there's a state program where
Right.
let's get it first. So we are a distribution point.
Right.
So what we want to do, as you're kind of alluding to, is we want to get it out to as many people as possible. Because overdoses can happen anywhere. They can happen in public spaces. If somebody is kind of, there's a lot of things we go into when we're training people, but if someone is kind of unconscious and it doesn't look like they're just sleeping, it could be an overdose. So we do a lot of trainings. We train community members. We've done them at we try to do it like libraries, but we also train other agencies. So our human services staff, the people who provide, counseling or psychiatric help, different prescriptions for people who might need that. We train them because they're out in the community with a lot of different people. So what I'll do is, when I do a training, I'll go to these places and we'll train them. It's kind of, it's like maybe a 30-minute training, but I always start with a 30-second version, and it's exceptionally simple, really. It's just, here's naloxone. If you think somebody is overdosing, all you're going to do is you're going to call 911. It's not like you have to be a first responder. You call 911, and you just kind of put this between your fingers, like I'm kind of holding it here. There's a little plunger, which my spring broke, but it's just one dose. You put it up their nose, and you squeeze.
Okay.
And that's it. It gets absorbed in the nasal passages, in your nasal membranes in your nose. And in a few minutes, if it's enough, sometimes you have to use multiple doses.
Okay. Are there any side effects or anything that you should be worried about of doing that?
That is the kind of benefit of this stuff. It has a really high safety profile. So it's safe for women, children. Honestly, if you gave this to like everyone in the world, the only people who would notice are those who are actively using opioids. So it really is very safe to use.
Okay. And should it be put up in a special place so that kids can't get to it? I mean, say if a child should get a hold of it, would it hurt them?
Sure. It wouldn't hurt them, which is good. The only thing you wouldn't want it to be wasted.
Right.
Yeah.
But
so one of the other points you're kind of talking about is, so we have this and we get it out to different partners and organizations and whatnot, but we try to get it out more to the public. So, for example, we've held some public trainings at libraries. You can always call up the health department and you can get it at any time. We'll do a little quick training. You can have some naloxone. There's these things called nalox boxes, which it's essentially a public vending machine for naloxone. And the idea is, if we put these in community spaces, say in like public bathrooms, where people can go and get them, you essentially just open a little cabinet, you take one, there's an information you peel off, tells you how to use it, and you go on your way. Because it's not necessarily something where, we want it like there available for an emergency. We want people to have it just to walk around with in case something were to happen as they're going about their life.
yeah, especially with the fentanyl, the way it's going crazy.
It can happen anywhere. And
Yeah.
that few minutes, I mean, all first responders in the area do have naloxone. But if you're in an area where it takes 4 or 5 minutes, I mean, this is going back to 6th grade psychology or whatever when we learned this. You have, from the time you stop breathing to you're dead, you have 6 minutes total. And in between is different levels of brain damage that can happen.
Yeah.
So each minute is so crucial that
Okay.
even if the EMTs are 2 minutes out, having this it can be life-saving.
So, yeah, cool.
Yeah.
With all you do within the community, do you think it is helping to get the message out?
That is a good question. One of the probably more boring parts of like what we do is we try to stay very data focused. So some of the work that we do is just constantly collecting data. So a few examples are we'll send out surveys to parents or doctors, or we'll ask them about different things, how they feel, what they feel they might want help with. DFC really tries to be data focused because there are a lot of, everyone obviously has good intentions. We all want to make a change. But with the certain amount of money we get every year as a grant, we really want to make sure we're kind of maximizing it.
Right.
So we really prioritize what is kind of backed by, what has been proven really works. What has there been, studies have been done about it to show that like, oh, this actually makes changes, this reduces use in places. So yeah, one of the things that we do is we then try to go back and see, after a certain amount of time, let's say we're implementing, for example, this curriculum in the schools. We will hopefully work so this curriculum that we've been implementing has just been for a few months. It's kind of just starting to get off the ground. But what we'd like to do then is, every other year, there's kind of this big survey that all the students in the county take.
Okay.
And then they will say, they'll kind of anonymously report, what they do, and then you get data around how many people are using things. So it's always kind of the answer to your question is, it's something we're kind of constantly trying to keep an eye on
Okay.
and kind of evaluate.
Okay. With the Elks, we've noticed it's been hard to get into the schools, get the information into the schools. Have you
Yes.
had the same problem?
Yeah, I think, and schools is a big one. There are a lot of different, we try to work with, so many, law enforcement,
Right.
volunteer groups, hospitals and whatnot. Everybody's busy,
Right,
of course, and
yeah.
schools are no stranger to being
But it's been
understaffed,
so hard to
unfortunately.
get the information into the schools. How have you accessed that, or haven't you? I know we did a joint webinar last
Yeah.
year, and that got into 7 of the schools in the area, which was awesome.
Right. Yeah, there's I'm a little bit fortunate. Emmy is obviously great at kind of reaching out to people, and so she kind of had a few relationships established with schools, so that there's a few schools that we had relationships with, and for us anyways, it's kind of just it's really figuring out what do you need help with, and then we try to help them with that. So yeah, it's definitely it takes a lot of kind of effort to
Yeah.
find the right people.
Yep.
But the more I do it, the more people I see who are really passionate about it. So yeah, we're slowly kind of reaching out to more schools.
Okay. Anything else you'd like to talk about before we close out the show?
I have a few more props if we want
Okay,
to go through
sure.
that. About how much time?
How much time?
You're at about 30 minutes right now.
Okay.
Okay. This is kind of related to the naloxone.
Okay.
So these are actual, I got this here. I don't know if you've seen this. These are brand new. As of a few months ago.
Oh, I just seen this. I don't know where I seen it. Whether it
testing
was on
strips.
Facebook or.
Yeah, maybe.
Yeah, that's cool. How to test your drugs for fentanyl.
So
That is awesome. And you have those?
Yeah, so we just got them. They were actually considered, it was kind of an older law, they were considered paraphernalia. So they were technically illegal.
Oh.
And then so that obviously, the state senate was like, well, let's change that. So finally, these are now legalized. So we actually just got 700.
Nice.
And the idea is you can essentially mix up a little bit of whatever you have, and you can test it to see if fentanyl is present. So.
So will this be available to anybody, or, how and why is it available? If I'm doing drugs, do I
Right,
want to
right.
walk into your office and say, can I have some of that to test my drugs?
Right, exactly. Yeah, there can be a little apprehensive. So
How is-
obviously, yeah. So it's definitely in one of the kind of the harm reduction aspects of. We can't always stop everyone
Right,
from using it
right.
immediately. That's just the reality of it. But we can still try to reduce the harm that's caused until we get them to that point. So this is definitely in that kind of vein. It's kind of one thing that we're actually exploring is if we have these in lox boxes, maybe we can include these.
Yeah, that makes sense.
Because you're in maybe like a public
Bathroom.
bathroom.
Yeah.
It's not like everybody's looking at you.
Yeah,
And
yeah.
then you can just take some, and they're free.
Yeah,
So-
that's a good idea.
Yeah.
Really good idea. What
So
else have you got in your
That's
little
I
kit
got my
there?
little box here.
Yeah,
this-
Emmy showed me, she brought those two with us to Lights and Sirens.
Yes. So we are actually, one of the things we do in the community is drug take back. Medication safety is huge.
Right.
One way that youth, kids can get access to drugs is in the medicine cabinet. And whether it's, from parents who just aren't thinking about it, maybe grandparents, maybe friends, and their parents. So it's usually something people don't think about, but it can be really crucial because that can be a way where people start using it at a young age,
Yeah,
and it
right.
becomes.
In fact, we just had
habit.
take back, what was it, yesterday, wasn't it?
Oh,
The 26th is
In
National
Watertown?
Take, well, we didn't have one. We
yeah.
usually-
So the National Take Back Day is Saturday. So we're actually
Saturday.
planning an event tomorrow.
Yeah.
In Lake Mills,
Yeah.
and
We usually have ours in April, I think.
yeah.
Because there's one in April and one in October, I think it
Yep.
is.
Yeah, we try to do them several times a year. So this is, so it's obvious. So medication safety. We don't want people who don't need them to have
Right,
them, whether
right.
it's expired or unused. There's probably some people who think like flushing them is fine, but we don't want that either.
No, it
We
gets
don't
in our
want-
water system.
It gets in the fish.
Yeah.
We don't want our fish don't need antidepressants.
Yeah.
We don't
They-
think.
we don't need big attack fish or something like that.
Right. Yeah, exactly. One thing that we hand out is we actually have little lock boxes that we hand out, so people can keep them in, with a little key. It looks like one of those fancy briefcases, but this is actually you can drop your medications off at any police
Yeah,
station.
the Watertown Police Department has one right inside their building here.
Yep. And all the police departments do as well. Yeah, maybe that doesn't work, and maybe some people don't want to go to the police department for whatever reason. You can deactivate any medication.
And how many pills or,
So each bag will do 30 pills, which is
30 pills.
usually 45. So
and
that's
it doesn't
kinda
matter
one.
what kind of pill?
Not really. If it's in a capsule, you might pour it out, but it's kind of like charcoal that where it deactivates stuff.
And then afterwards, what do you do with it then? Just
Then you can just throw it away.
throw it in the trash?
Because in theory, if you have medication, throwing away is not putting it in the water supply, but then somebody could just go grab it or
Yeah,
something.
yep.
So this just kind of makes it inert, and
Yeah.
turns it into.
Yeah, and then Wisconsin this year was the state that had the highest amount of drug take-back.
Oh, really?
Yeah,
Oh.
across the nation.
That's great.
Yeah,
Yeah, it's good. One of sometimes the drug takebacks are, we'll do that, and we'll do, we collect medications, and sometimes people ask, what do I bring it in? They usually just say like bring a little plastic baggie, and you either drop the plastic baggie, or sometimes they'll even just have you pour it out into the bin. The one other kind of little prop here I have is, this is kind of going back to alcohol, but we actually did a focus group with some students a little while ago, and we heard that one of the main places that kids are able to access alcohol is everybody kind of knows somebody who might have, it's not like every single family, but everyone knows a family who maybe like keeps a fridge of alcohol like in the garage or something.
yeah.
There's usually enough alcohol in there. If there's something missing, you don't even notice. And so one thing that we encourage is, and then we hand out are, it's just
Oh,
a fridge lock.
breathalyzer. Huh?
Fridge lock.
Fridge lock. Oh,
Yeah.
okay.
So the idea is to, in the effort of preventing, kids from using, is just a simple kind of this keeps people accountable if they've been in the fridge. So it essentially just kind of sticks on either side, and then you can have a little key, and you can decide, when the fridge is open. So that's one thing that we encourage for, kind of parents.
For parents that have alcohol. You can
Yeah.
also put that, they don't always put it in a fridge, they have a cabinet.
Like a cabinet.
You can do the
exactly.
same thing.
Yep. Yeah, exactly.
Anything else in your little kit?
Those are all the exciting things. We have these little pouches for naloxone if you really want to feel like Batman. But yeah, I would encourage anybody, any of these resources. We always have them. We try to get out in the community events and hand them out, but we can always call us up. And
Okay. Anything else you'd like to?
I think we covered a lot. Let me see if there's anything else really interesting, but I think we got most of it.
Has the coalition itself noticed any fentanyl deaths in the area?
We actually just established what's called an overdose fatality. We made a group. It's another little mini grant that will allow us to look at what overdoses are happening in Jefferson County. How did it come to be? What are the circumstances around it? So our hope is to actually use kind of that group that just started to learn more, and then we can develop strategies to kind of combat that. So we're excited about that. I think the rates of overdoses have, they went up in the last few years, gone up like 30 or 40%. So there's 15 overdoses in Jefferson County last year.
Wow.
Which is
just from fentanyl itself, or?
That would just be opioids. So it could be almost all opioids have fentanyl in it. So most likely.
Okay.
Yeah.
Anything else you would like to share?
I think that's, I could go for hours probably, but no, I think we went over quite a bit. So.
Okay. Well, I thank you for being here today.
Yeah.
And
great.
I'd probably like to have you back, and I'd like to
I'd
keep
love
in
to come
touch,
back.
and maybe we can have you as a co-host once in a while.
Sure. That sounds good.
All right. Thank you, everybody, for joining us today. See you at your next show.